Good morning. My name is Van Laskoski. I'm the Public Information Officer on the Emergency Management Team here at Stevens County Hospital, coming to you on March 25th, 2020 for our daily update regarding COVID-19. I'm going to jump right into it. Lots happened in the last 24 hours. As many of you have now heard, the Department of Public Health announced yesterday that 2 residents of Stevens County have tested positive for COVID-19. We're not able to give any information on these cases as they are not patients we've tested in our facilities. Our information is very limited regarding those cases, but we certainly want to offer our prayers for those individuals and for anyone who's been affected by COVID-19. Here in our hospital, we have tested 14 individuals. We haven't received any positive results yet, but we are waiting on 9 of those results to come back. We have received 5 negative results at this time. In light of recent news, we have taken extra precautions to minimize risk to our staff and patients by reducing the hospital to essential staff only. As such, our business office team is working remotely from their homes. We're most grateful for their work at home and appreciate our IT department for helping set that up. This is the department that is responsible for collecting payments, and they are still collecting payments. There are a few ways you can do that if you want to pay on a bill. You can go to our Stevens County Hospital website, which is just www.stevenscountyhospital.com. You can mail in your payments to the hospital at 163 Hospital Drive, Toccoa, Georgia 30577, or you can call the business office. There are 2 lines that you can call if you want to discuss your bill. You may get a voicemail because our call volume's been pretty high, but if you leave a voicemail at these numbers, they will call you back. The phone numbers are 706-282-4284 or 706-282-4247. I want to thank the community for their support. It's been truly fantastic, especially this week as we are seeing cases start to develop in our county. We've received tremendous support for our whole organization, especially our nurses and doctors, and our clinical staff is doing a fantastic job. But I want to give some recognition to some other departments as well, because this certainly takes a team to run our hospital and to treat our patients effectively. First, I want to recognize our registration department, who is truly on the front line of this. They're the first people that you're interacting with when you're coming into our facilities, and we really appreciate their efforts in receiving our patients. Our lab techs who are collecting and processing specimens, our radiology techs, our patient care techs on the floor, our dietary staff for ensuring our patients and our staff are fed around the clock, environmental services for making sure that our patients can be treated in a sanitary environment, our engineering team for making sure that our facilities and our equipment is functioning around the clock, our medical records department for making sure we have all the appropriate documentation we need for medical care, our business office for keeping the revenue flowing. We can't function without that. We really need these departments to keep going. Our IT department, especially as they've helped our business office set up to work remotely, they've done a tremendous job over the last few weeks helping us through this crisis. Our human resources department, who's now managing staff in a multitude of locations, those working at home, those working here, people working in our clinics, and then they have a tremendous task making sure that we can keep staff coming in and hiring new staff, because we don't know what this virus is going to throw at us, and they're working feverishly to make sure that we have enough staff clinically to continue to function. Our materials department for making sure that we have all the supplies, the PPE, everything that we need, all the stuff that you hear about in the news in terms of shortages. they've done a tremendous job making sure that we have the equipment that we need to treat patients effectively. Our pharmacy for making sure that we get all of our medications in. Our rehab department for continuing to see our patients who need physical therapy, both here in the hospital and our outpatients. Our cardiac rehab for keeping our heart patients in their programs. Our personal care homes for keeping their residents safe during this crisis. It's a tremendous order. Our executive leadership here at the hospital, they're the ones making the tough decisions and really on the front line of looking forward and saying, what do we need to do? What do we need to be preparing for? Are we prepared enough? And our hospital authority, of course, our governing body for their support, their leadership, their governance, both here in the hospital and out in the community. We say all this just to make sure and make you all aware that it takes truly a huge team of people to combat something like what we're seeing right now. It's something we've never seen before. And everyone throughout this entire organization is working extremely hard. And I want to make sure that we give appropriate credit to them. We thank you for your time. We will be updating you again tomorrow. Until then, be safe, practice social distancing, good hygiene, and if you're able, stay at home. Call us for anything that you need, or come see us. Thank you.